Three, two, one. Now live,
Hello
Doc.
there, everybody. Welcome. Dr. Garrett Weagroff here at Pure Plastic Surgery. We typically do Thursday Thoughts. I was out on Thursday. Today we're doing Friday Thoughts. We're going to be talking about some of the decisions we have to make when it comes to choosing an implant. We've gone over this before, but I think one of the more difficult things for some patients to conceptualize is the different levels of cohesivity of the gummy bear or silicone implants that we use. So as we've kind of discussed before, our implants are based on measurements based off of the width of your chest, and then how much projection or how full your breasts are going to look is based on the profile of the implant. So we have the different profiles here. The most common ones I use and my patients get are moderate and full profile. So that's part of the discussion. Part of it is the size, and that's related to the profile based on your measurements. But then we get into another question of the amount of cross-linking in that silicone and how firm it is and how much of its shape does it retain, especially over time. When we're talking about that, we're talking about the different styles. Specifically, we're talking about the Allergan product, the Natrel implants that we use here at Pure Plastic Surgery. I really love these implants. I think they're a superior product compared to what a lot of it is out there. When we're talking about silicone, people often say the gummy bear style implant. What does that mean? It's not a loose liquidy silicone gel that's inside these implants. It's a cohesive gel that almost looks like a gummy bear. If you were to cut a gummy bear in half, that's what it looks like. But we have different levels of those cohesivity when we talk about this. The most common implant that we use, and there's a cost difference between the implants, so that's where it comes into part of the discussion. And I want to educate people on why you may want to go with the more expensive, which is also the more cohesive implant in certain scenarios. So the responsive is the one that we use most commonly, and that's the one that's included in most of our breast augmentation quotes. And then the price can go up from there a little bit. So I'll rearrange these in order of what they are, because to correlate with these pictures. So when we're talking about upper pole retention, you got to think about the implant sitting in your breast. So these are all 365 cc full profile implants. You can see for the responsive implant, it's the softest, meaning it squeezes the most and perhaps feels the most natural, but it does not perfectly retain its shape. And you can see a little bit of the rippling at the top of the implant. So this really comes into play when you have someone that doesn't have a lot of tissue coverage, and then the soft touch is the Goldilocks version. It's the one in the middle. You can see a little less rippling. It retains its shape a little bit better. And then the most cohesive is actually called the cohesive implant. You can see at the top, it really retains its shape. So we're able to see kind of the different levels here. So someone that has a fair amount of breast tissue, especially someone that's getting a submuscular implant, it probably doesn't matter too much the rippling. So responsive or soft touch is a really good option. For someone that has less tissue coverage, meaning if you pinch the top of your breast, how much tissue you have covering that, especially if you're going with the subfascial approach, the more cohesive implant is probably a better choice because it's going to maintain its shape better over time. You're not going to see any rippling through the skin like you may see with a responsive implant. So I hope that helps clear up some of the confusion when it comes to choosing the different styles of implants. And do we have any questions on that particular subject?
Okay. This is related to the leaf. For the upper fullness with a breast leaf, there's needed any kind of implant or any size? There's a typo there.
Yeah. So yeah, you're asking, does this come into play with a breast lift? And so for my patients that I'm doing a breast lift on, I always put the implant underneath the muscle to give it an extra layer of protection because they're just doing some additional incisions. So I think a responsive or a soft touch is fine for those patients. The patients that want a subfascial breast augmentation, which means above the muscle but below the fascia, the ones that have a thinner pinch on the top of their breast are really the ones that are going to benefit from the cohesive implant or the soft touch implant.
This is on TikTok. Well, first, good morning, dog. There's a message for you, and here's good afternoon. But here is there's any difference between saline implants and silicone implants in terms of breast capsular contraction?
No, there really is not a big difference between the risk of capsular contracture between silicone or saline implants. At the end of the day, even a saline implant still has the outer shell is a silicone shell. So what's actually touching your body is the same material. There's a slight difference between having a smooth implant and a textured implant. We don't really use textured implants anymore in the United States because of that very low risk of breast implant associated lymphoma. But that was one change in the difference between textured and non-textured implants. But in terms of saline and silicone, no, there's really no difference in the risk of capsular contracture.
Okay. She asked TikTok. Okay, here, Dr. Uyghur, if there's any way to get upper fullness without an implant and just with fat transfer?
So yeah, fat transfer is an option to help achieve some level of upper fullness, but it's never going to be as robust as an implant. An implant is very structured and reliable and predictable on how much retention of that upper pole fullness you're going to get. Fat grafting can be done, it often requires multiple rounds. It's never going to be quite as definitive as an implant for the upper pole fullness. So for restoring volume for someone that's had some children and just lost volume, but you want to get back your more youthful looking breast, but a natural looking breast, fat grafting is a great option for you.
I'm thinking about having lipo. Can I have breast implants at the same time?
You can. In the state of Florida, we're limited by how much liposuction we can do when it's combined with another procedure like breast augmentation. So we're limited to 1 liter. And I also like to try to keep all the liposuction towards the front of the body if we're going to be doing a breast augmentation procedure, because you're going to be laying on your back during the recovery phase.
Okay, I think this is the last one. There's any age limit for breast implant?
No, there's really not an upper age limit for placing breast implants. For younger patients, when you choose to get silicone implants, if you're younger than 22 years old, that's technically an off-label use because all of the studies were done on patients 22 and older. So the warranties may not kick in like they do for some other patients, but if you still want silicone implants, I'm okay doing that as long as you understand that difference and that the studies were not done for patients less than 22 years old.
This is a message for you. Doug says, "Hi doctor, thank you for everything you do for me. I appreciate the best doctor ever."
Thank you very much. I appreciate the thanks.
Well, asking for the price, how they can get the price, Doug.
Please go to our website at pureplasticsurgery.com. There's a very simple little window. You provide some information and we'll start the virtual consultation process and we'll get you some baseline pricing and we'll go from there. I look forward to meeting you all. All right, have a great weekend, everybody. I'll see you next week.
Okay, boom, boom, boom.